Well, for almost 2 years, Hartford Healthcare has been using an advanced technology to manage heart failure patients from home. This week, the Heart and Vascular Institute will celebrate a milestone with the implantation of the 100th pulmonary artery sensor called a CardioMEMS device. Here to discuss the procedure is the medical director of the Heart and Vascular Institute, Dr. Howard Haronian. Doctor, thank you so much for joining us today.
My pleasure. Good afternoon.
We want to start with describing exactly how this procedure works.
Sure. The procedure involves the implantation of an extremely small pressure monitor. It's literally the size of a baby aspirin. And we implant it into the artery of the lung of the heart failure patient through a small catheter that's put in the vein temporarily. The whole procedure is an outpatient procedure. It's performed in a special X-ray room called a cardiac catheterization laboratory. And once this monitor is implanted, the catheters are removed and the patient go home within an hour or two. And from there on, we can measure their pulmonary artery pressures from home.
Doctor, who can get this procedure and how can they benefit from this type of technology?
Well, any patient who's been diagnosed with heart failure and has been unfortunate enough to be hospitalized for heart failure would benefit from this procedure. What this allows is very accurate measurement of one of the first signs that fluid is building up and the heart failure is worsening. Oftentimes patients wait until they are short of breath or their legs swell, and then they call us, and it's really too late for medications and pills to do the trick, and they have to end up in the hospital again. And those patients, we find, if we could pick up their decompensation, we call it, or their worsening of their heart failure, if we could pick that up earlier, we could avoid that hospitalization. And that's what this program is all about. With that monitor, it's as though the patient were in one of our ICUs with a catheter in their lungs. We have that type of accuracy in determining if they're building up with fluid. And then we can make adjustments from home well ahead of them worsening enough to require hospitalization.
Okay, Dr. Haronian, a lot of good information there. Thank you so much for joining us today.
My pleasure.